Good morning. I'm here to bring you your daily mental health enlightenment. And on this, my oldest daughter's 17th birthday, I want to talk about parenting. Now, we've all heard the saying that parenting is the hardest job, and it truly is, because it requires us to use every bit of ourselves in order to be our best and do our best job. And because the job itself is so important, because we are responsible for the molding and development of another life. So the first point that I want to talk about parenting is the fact that parenting is a mental health issue. When I talk to parents about the issues they're going through, and then I suggest that they come to therapy, they're surprised. They're like, parenting is an issue that you go to therapy for? Absolutely. Parenting is a therapyable experience, and every parent should go to therapy. Because it is such a challenging job, because it is such an important job, because you want to make sure that you are constantly doing your best. Going to therapy to get some support and guidance and just having it as a checkpoint is very important. So I want to talk about the four main reasons that I believe that parenting is a mental health issue. So the first reason is that parenting requires us to address the issues that life has given us. We have to identify, address, and work on our own issues in order to be the best, most present parents that we can be. If we are bogged down by our own issues of trauma, our own issues of hurt and abandonment, our own depression and anxiety, that all those issues serve as a buffer between us and us being able to most effectively parent our children. So we need to be able to work that stuff out and manage that stuff. And so going to therapy to have someone help and assist you with that process is important. The second reason that parenting is a mental health issue is because the parenting experience itself pulls on your emotions. And remember, we've talked about mental health and our emotional experiences being on a spectrum from positive to a negative end. And so parenting gives us strong emotional experiences. Every parent out there is guilty of getting caught in a moment where you are just gazing at your child in awe and amazement that you created them, that they are here, and that they are being so successful, striving and thriving because we're the ones who birthed them and created them and got them here. And so that's a positive experience, an emotional experience that pushes us to be our best, that pushes us to challenge ourselves to do things that we ordinarily may not have done because we want to be better for our children. But on the other end of that, parenting can bring those negative, unpleasant emotional experiences too. When we are challenged with parenting, then we begin to question and doubt ourselves. We begin to feel guilty and feel a sense of shame when we feel like we've done our child wrong. We're disappointed in ourselves for things that we've done. We feel a sense of disappointment in our children. There's anger that we feel with our children. There may be resentment that we feel from the other parent who may not be providing as much support, or who may not be doing the parenting job the way that we think they should. So there are a lot of also unpleasant feelings that come along with parenting that make it a mental health experience, and that would make it a good idea to go to therapy to get some support for those emotions. The third reason that parenting is a mental health issue is when you are parenting the non-traditional child. And I'm using that term in a loose form just to be able to identify children who have chronic medical health conditions, children who have mental health conditions, behavioral disorders, emotional disorders, that leads to them having problems being able to function appropriately within society. Those children are who I'm identifying as non-traditional children, because although we know that there is no handbook to parenting, we all do have a general guide about what the parent-child dynamic should look like. And so children who have these chronic or severe issues fall outside of our idea of what the traditional parent-child dynamic looks like. And simply because of that, that challenges the parent, because we really feel lost about what to do when we look back and say, I wasn't like this as a child, so I have no idea how to help my own child, or my parent didn't have to deal with this, so they don't know how to direct and guide me with dealing with my child. The other thing that makes it hard is that we have to deal with society who doesn't know how to deal with our child who has a chronic medical or mental health condition. One classic example of this is in the schools, in the classrooms. And although the schools are doing better with addressing these emotional health and behavioral issues, there are still challenges that come up when you have a child that has a difference with learning. So they don't learn in the traditional way, so they can't thrive and survive in the traditional class setting, and the ways that this throws that teacher off from being able to go about status quo and meet their goals and agendas. And so then they treat your child in a certain way, and then that becomes a stressor for you that you then have to manage and respond with. So parenting the non-traditional child is also a mental health issue, and I always encourage those parents, go and get some therapy. That does not mean that there's anything wrong with you. It means that you need some support dealing with this very challenging issue, something that is outside of the typical norm of what we expect for the parent-child experience. Get some support for it. And then the last reason that I think parenting is a mental health experience is because everything that you do as a parent is emotionally impacting your child. So you have to be mindful of how you're parenting your child. You always have to have purpose behind what kind of parenting you provide to your child, because everything impacts them. One of the sayings that I hate the most is that when people say children are resilient. Children are not resilient. Children have impeccable coping styles in the midst of some huge challenges, but they are not resilient, because I work with the adult resilient child, and they are torn up. They are psychologically distraught, and they will tell you that because the adults in their life at the time did not do their part to emotionally take care of them. So the other reason that parenting is a mental health experience is because everything that you do emotionally impacts your child. Okay, so you all probably have gathered from my videos that I rarely give advice on how to manage an issue, how to manage depression, how to manage anxiety, how to manage bipolar, ADHD, relationship issues, because therapy and emotional health issues are such a personal experience that you and I could have the very same issue, condition, diagnosis, but have two very different journeys of how to manage those issues, because the background information, the historical experiences that we went through were different, that led us to the diagnosis or the condition or the experience that we have. So it requires us to have different journeys. So I don't give specific advice. So today for parenting, I don't have specific parenting advice, but I do want to give just a general, a 6-point guideline of what you can use to make your parenting more effective. So the first general parenting tip that I have is that you want to be clear about the line between your issues and your child. I see people all the time that have their own issues that came from childhood, that came from their own traumatic parent-child experience, and then they put that on their child and their parent-child relationship, and that is unfair to your child, and it shows that you are unhealed and have some work to do. One classic example of this is the person who was raped or molested as a child, and so now they don't allow their child to do anything because of the trauma that they went through. Not that they use their discernment to decide if this is safe or not safe and their antennas are up more. No, they everything is a no. Everything is unsafe, and that is unhealthy because you are limiting your child's experience and you are spewing your own hurt and trauma onto your child's life. So you want to be clear about the line between your issues and your child. The second thing is that you want to identify your parenting goals. You want to have some direction and some purpose behind what it is you are doing with and for your children. And remember, your parenting goals should be on a general level, not specific, because you're raising a person. So your child should have specific goals for their life, and you should have a general guiding set of goals to parent them, such as I want to raise a child who is courageous and always stands up for what they want, or I want to raise a child who knows the value of their voice and who is always willing to speak up for themselves, or I want to raise a child who goes after their dreams with vigor. And then once your child identifies their specific goals, such as playing softball in the Olympics, then you can use your the greater goal of helping your child have vigor to accomplish their dreams in order to support them. The third thing is that you want to understand your child's needs. Any good parent will tell you, I love both of my children the same, but I understand that they are different, so I don't treat them the same. They have different needs, and I need to accommodate both. It is so many parents out there that I come across who do not know their children. They don't understand their children's emotional capacity. They don't have an idea of what their children need from them. They don't understand how the experiences that their child has been through has emotionally impacted them. And so the kind of parenting that they in turn need from their parent in order to survive what they've been through, so many parents are so disconnected from their child's needs. And so it's very important for you to understand what your child's needs are. The fourth thing is that you want to provide a sense of structure and guidance to your child. Imagine if you went on a job. You didn't get a description of the job. You didn't get any job training. You didn't get an orientation. You didn't get someone to shadow. They just put you on the job and told you that your paycheck and your ability to support your family is determined by how well you perform on this job, but they don't tell you what is expected of you. Imagine how insecure you would feel, how unsafe you would feel, how lost you would feel, how confused and angry you would feel, on edge all the time that you would feel, not knowing what am I supposed to be doing, and am I meeting my target goal? Am I going to keep my job? That's how we make our children feel when we don't provide them with the structure and guidance that they really want. Children, they thrive for that. That's what they want. So when we give them a target point to meet, they know in what direction to aim. So we've got to do our job and give them the structure and guidance that they need in order to be successful. The fifth thing is that we want to be clear about what constitutes abuse. There are so many parents I come across who don't understand that some of the things that they're doing are abusive. They don't have an idea that the things that they're doing are emotionally abusive, that they are inflicting verbal abuse on their child. People have a clear idea about physical abuse. The biggest disconnects that I see are the emotional abuse, the verbal abuse, and the neglect. And I'm talking across all people where I see this struggle. So you want to be clear about what is abusive and making sure that you are not being abusive. And connected to that, understanding what is traumatic for my child and making sure that you don't do things on purpose that traumatize your child. The last thing is that once you have done your work and you are your healthiest person and you're not spewing your issues onto your child or your parenting experience, and once you're clear about what it is that what and who it is that you want to be as a parent, then you want to be consistent with your parenting plan. It is important that however you choose to move forward, that you then be consistent with being that parent. All right, that is the video for today. I hope that you have enjoyed yourself. Again, I want to wish my daughter a very happy 17th birthday. I love you. So, what is the message? To think about mental health in a different way, a way that helps you to understand that parenting issues are mental health issues. And I'll see you tomorrow.